I'm Dr. Kemp Clark. I'm here in the Barrow Neurological Institute conducting an interview with Dr. John Green, who is the founder and currently the director of the Barrow Neurological Institute. This is being done for the Archives Committee of the American Association of Neurological Surgery. John, welcome. You're now going to be famous.
Thank you.
Tell me a little bit. I know that you are originally from the Pacific Northwest. You went to medical school and took your residency in Chicago. What drew you to Phoenix in those early days? What was here that attracted you?
It was mainly climate, Kemp. I'd contracted rheumatic fever out in the Philippines during the war and had returned to Chicago to get sharpened up again for another 15 months as a senior resident. And the time, my opportunities academically were in a new medical school in Seattle and in New York City. And I thought perhaps, and I was advised by my doctors, that it would be better if I ended up in a warm, dry climate to avoid any future complications. And we looked at the map that Paul Bucy had in Chicago. He was secretary of the American Board at that time. And there was a void of neurosurgeons between Dallas and Los Angeles and Denver and Mexico City. And Phoenix was the exact center of population, listed at that time at 60,000 people, although in truth in 1947 it had 150,000 people, which is 1/10 of what it is today.
Is that right? It's interesting that you were the first neurological surgeon in Arizona, is that right?
Well, I'm the first one to start practice, but Dr. John Eisenbeis came. We were licensed at the same time, and he started practice about 3 weeks after I did.
I see. Did you start here at St. Joseph's? Or were you just all over town?
I actually started down at St. Monica's Hospital for the most part, and then later I got appointments here and at Good Samaritan.
And tell me a little bit about, I know you formed associations with some of the people who are still with you, even before the Barrow Neurological Institute began. And for example, where did you find Hal Pittman?
Well, this was 1957, 10 years after I'd come. My first partner was Harry Steelman, who came in 1953, trained at the Montreal Neurological Institute. And I, of course, was trained in Chicago at the Neuropsychiatric Institute of the University of Illinois. And I thought someday it might be possible to get something going of an academic nature here, and that I would always choose my associates with that in mind. And so Harry unfortunately died in 1961, but Hal was already here, Hal Pittman, and we didn't have our opportunity to do anything very much except to consolidate enough practice that we could afford to go to one institution and say, this is what we're going to do. And that opportunity first came in 1953 when I took care of Mrs. Charles Barrow.
And who were the Barrows? And if you can, without disclosing any confidential information, what was exactly the problem?
Well, she had started with seizures as a young woman, and this had turned out to be a tumor, an oligodendroglioma of the right frontal lobe. And she'd been operated originally in Cleveland by Jim Gardner. And when her recurrence occurred, it was February, the weather was bad up there, and I had been highly recommended by people they trusted, and so I took care of her. She fortunately came out quite well, And it was after that that he suggested to me that he would like to give to something I was interested in. This turned out to be our need. We just moved into the new St. Joseph's Hospital here in 1953. And what I really wanted most was to get an epilepsy clinic established. And this was far more than a normal fee for the operation, but we made an exchange. And that's the way we got it started. And then each year after that, he would come to me and say, I've got a little tax money. And this was amounted to perhaps over the next 5 or 6 years, about $60,000, $70,000. Always, we put it into something at St. Joseph's, at this hospital, that might, that would definitely aid and abet our work in neurosurgery.
So from these humble beginnings, this all
That's
came.
where it started, yes.
It's interesting to realize now that you told me there are 18 neurosurgeons in Phoenix now, 9 of whom are associated with you. I've had for a long time a great admiration for the way in which you have managed this institution in a conservative, private practice-oriented situation, that you've always maintained this as essentially an open staff, that anyone who was qualified could come and use the resources of the Barrow. I think that's a unique thing. Would you comment on how you did this? I mean, well, it obviously worked out remarkably well.
I didn't do it. We had a lot of progressive people here, and as you well know, no institution is because of one man. He might be a catalyst, but it takes a lot of working together at all levels, staff, administration, and community, to make something successful. And because of the massive growth of this community and the fact that there was no medical school in the state at the time, what we really, our idea was a little mini university of the nervous system in a community hospital. And we had wonderful help. My goodness, many of our friends, thinking of where you were trained at New York Neuro. New York Neuro was, as you know, the first neurological institute in America, and founded in 1909. Now, Larry Poole, who I understand you're going to interview soon for the same purpose,
Exactly.
was a first-class provider of information about what to do and what not to do. And then the same way, Ted Rasmussen, now retired as a director, but was most generous with his time, and about, again, what made it truly a fine institute and where the pitfalls were. Percival Bailey, and Eric Olberg, Paul Bucy, Loyal Davis, people from Chicago who I'd known well, were most generous for their time. I remember taking our plans that we'd developed internally to the best of our ability to all these people and going to Hopkins with Earl Walker. He was, we spent until about 3 o'clock one morning after having spent the day, because he was so excited about the opportunity of something new, and he was wonderful. And all these fellows were great. I can't just offhand name everybody, but Henry Schwartz and Arthur Ward, their services were particularly helpful in looking at the training program. From the start, I didn't feel that it was worth doing without having a neurosurgical training program. And that was really, the whole buildup of that institute has been around what it takes to be competitive and effective for accreditation.
Well, you've certainly done that, because I see a number of people who are interested in going into neurosurgery, and the majority of them say they're going to come and look at this place. How many applications do you get a year? Do you have any idea?
Oh, it averages around 50 for one or two places.
Yes. You take 2 a year, or alternate 1, 2?
Well, at the time I represented the region on the Manpower Commission, as you well know, I took it seriously, and we cut our program back voluntarily from 10 to 8. And then I soon found I was stuck with it. And now that we have so much more volume than we did even then, we're figuring ways and means around that problem. It's all the program directors did.
Sure. What means are you considering? You're using paramedics or nurse clinicians, or both, or something
We
unique?
have rotators from our county hospital in general surgery, and we have fellows who come in after their residency in neurosurgery.
Yes.
That has been instituted since my successor, Robert Spetzler, is in charge.
Yeah. Yeah, that's what Neil
Martin.
was here as a vascular fellow. How's that worked out? Has that caused any problem with your senior residents? You've got enough volume?
Well, as I've observed it, and I'm most interested, of course, I think it's been great. They really haven't, there's enough work in the first place for the fellow and the senior resident both, that there seems to be no need for any real competition.
That's been our experience as well. What about pediatrics? What are your plans for pediatric neurosurgery?
Well,
Since that seems to be the one clearly emerging subspecialty of our specialty.
yes. Well, over the years, Hal Pittman has done the majority of pediatric neurosurgery, and he's just excellent at it. But looking at the realities of life and looking at Hal's age, which we all have to do, and with his help, Dr. Spetzler and all the rest of us brought in Hal Rieke from Case Western Reserve as of January of 1985. And Hal is just a first-class fellow, and he's already doing more work than we did together before.
Is that right? Didn't Bob Spetzler come from Case Western as well?
Yes, we have a little Case Western mafia here now.
And what about your own plans for the future? I know you're not going to just hang it up and pull a Larry Poole, if you'll pardon the expression. When he left, it was 3 years before he even showed up at a neurosurgical meeting again when he walked out of the institute.
Well, I'm sort of a cross between Larry and somebody else. I'm going to practice as long as I'm healthy. And I'm going to pursue my interest in history of medicine, and more specifically neuroscience and neurosurgery, neurology. And I think perhaps my main asset, the one the administration will appreciate more than any other, will be to raise as much money as I can. I figured that we need about $10 million in the next 5 or 10 years in order to keep our momentum and our quality.
Well, having watched you in action, I have no doubt that you will reach that goal. For those of you who don't have a feel for this institution, I have to say that I was honored to come here as the Goldwater Professor, which is a week of absolutely superb entertainment and hard work as well. And this culminates with the Barrow Ball, which was a very elegant affair. It was attended by everybody of prominence in the state, and John raised his money very successfully at that particular function and throughout the year. That's a marvelous thing to do.
Thank you. Well, it's fun, but it's our way because we don't get any state money, and we do pretty well on grants from NIH and other sources, but that's tighter and tighter, and if we're going to bring in some of the people that our neuroscientists need, we have to be secure within our own right. And
what sort of basic science support do you have here? I think that'd be a very interesting thing to know.
Yes. Well, one of my former patients who came in here paraplegic after an auto accident was operated early and fortunately made a full recovery. And about 10 years later, the family gave us an undesignated $2 million for anything we wanted, and we put that immediately into the Research Endowment Fund, which has been designated for the Division of Neurobiology. We're delighted with our neurobiology developments now. We have Dr. James Bladel, who came from University of Minnesota, MD, PhD, world-class cerebellar physiologist.
Absolutely.
But a marvelous teacher, and he has taken a personal interest in our residents. And as he did at Minnesota, and did so well, and we were absolutely amazed when he answered our ad in Science for head of neurobiology here, because we thought he was set for life where he was, but little personal things in the family in Minnesota and the cold had a lot to do with that.
Well, 2 feet of snow up there today, yeah.
And so I'm sure that Lyle French didn't retire because of that, but it was all the same year. Maybe that's why he came here.
You mentioned a moment ago about there was no university in Arizona at the time that you started here. And there now is, of course, a medical school in Tucson. It seems a little strange to me, coming from a state that has 4 medical schools, none of which are located logically, as to why they did not pick Phoenix, which is the center of the population of the state.
Yeah.
Political.
It's a good question. I happen to be one of the leaders of the medical contingent that wanted it to be at ASU. But there was a committee.
That's Arizona State at Tempe here,
Yeah.
just outside of Phoenix.
Yes. And, but we lost. And my understanding of it was that when some of the leading citizens in our city came to our group and said, don't do this or the Tucson people won't support the Central Arizona Water Project. And so so we backed off.
But you do maintain some relationship with the University
yes.
of Arizona Medical School.
Yes, we have a good relationship there. In fact, we had a academic tenure committee of Barrow Institute with the 2 representatives, physiologists and anatomists from Tucson last night. And again, we were discussing how we could get together. The way it's being done is that at the basic science level and at the neurobiology level, we have trainees from there, and we send trainees there. And we can go the route to a PhD via that route in neuroscience. At the clinical level, it's a little more difficult because we have the large volume of work up here, and because of the way and the problems the surgical department, neurosurgical department, and neurology departments have had, and the small number of beds in the University Hospital, we would have to say, well, to rotate residents there, they have to be better than any place in the country, or we can't afford to send them there. if they're better at something than they are, say, in Dallas or in, where else have we sent them? To Toronto Sick Children, to Charles Drake up in
London, Ontario.
London, Ontario, or Yassergill, or to your dear friend Lindsay Simon, where all of whom have trained our people for short periods of time, which have been wonderful. Well, it isn't fair to the trainee not to send them to the best place unless if you're not as good as that, then you ought to send them somewhere else. And so that's the way we're working.
You know, I wonder if some of our answers to our problems of training of residents isn't to go back to this type of saying that we're not very good at pediatric neurosurgery, so we ought to send them up to Harold Hoffman at Toronto Sick Kids, or we don't do stereotactic surgery, so we ought to send them out here to Andy Shetter and let him teach our people how to do it instead of once or twice a year getting the frame out to do something. I personally think that's a way that we ought to explore and not be so locked in. And we may be able to do it because, at least in my impression, is that fewer and fewer of the residents are married, fewer and fewer of them who are married have children, which has been the big reason for not being able to do it in the past.
Yeah.
I think that's at least a possibility. And certainly in our program, our ability to send them with Lindsay, for example, proven to be a marvelous experience.
We have two criteria before the administration will continue their salary, and then we find their travel money. One is that we can't do it here, and the second is that they're at a junior status and will be coming back to us rather than going to somebody else. That way they infuse the whole program with what they've learned.
Absolutely. I think you're an absolute genius, because we cannot fund our trainees any other way than from our own practice plan when they go abroad. And you're able to get the administration here to pay them a salary?
I'm not going to let the administration see or hear this film.
Very good. John, I want to thank you. It's really been fun doing this, and I know it will be a very well watched and admired tape.
Well,
thank you again.
Thank you very much. I enjoyed it.